Hi everyone, this is chapter 32, last chapter. This is dealing with drug therapy for the female reproductive issues. So we saved the best chapter for last. Anyway, definitely read up on the pathophysiology of the female reproductive system as well as menopause, because that's going to teach you a lot of stuff, especially like when periods and that start, why we have those things. So look at that stuff. There are different types of perimenopausal hormone replacement drugs that we're going to talk about. We have conjugated estrogen, and usually that's low doses of estrogen are given to increase the level in the blood, which will help with those menopausal symptoms that do occur. And on page 495, those are some of the menopausal symptoms that occur. There can be atrophy of the vaginal tissue, dry skin, increased rate of osteoporosis. And we just talked about osteoporosis and how important estrogen is for osteoporosis. Painful intercourse because, of course, they have drying of the vaginal tissue, reduced cervical mucus, and then there's symptoms related to high follicle stimulating hormone levels, like decreased mental concentration, hot flashes. Everybody knows menopausal women go through hot flashes, night sweats, and sleep difficulties. So that's not uncommon for those things. On page 495 are common drugs that we take for perimenopause. Conjugated estrogens are a big one, and you can see the different. Premphase and Prempro, all those are ones that we do give a lot of, and that you'll see a lot of women taking. So those are some things that you could think. So the intended responses of these drugs, of course, to decrease a lot of those symptoms, decrease those hot flashes, decrease those night sweats, decrease the vaginal dryness that can occur. So those are some responses that we do want to occur. We want to get rid of a lot of those symptoms. Prevent osteoporosis. That's a big, big one. Side effects for these, though, can be bad. You can get some breast tenderness, breakthrough bleeding, fluid retention. You will gain weight and acne. So that's not uncommon for that. High adverse effects, and these are bad, bad, bad. High risk for myocardial infarcts. Okay, these medications are not, and I'm going to say one more time, not recommended for long therapy use. Because of the risk for myocardial infarcts, which is a heart attack, and we don't want that. Another thing is it will increase blood clotting. So if that is the risk, it puts you at risk for blood clots, puts you at risk for DVTs, puts you at risk for pulmonary embolisms. So a risk for thrombus and emboli are not impossible if you're put on these medications. And if you smoke, guess what? This will increase your risk for clotting even more. So if you're taking any of these medications, any of these perimenopausal hormone drugs, and you smoke, that puts you at higher risk for blood clots, which will put you at risk for strokes and heart attacks. If you're on these drugs and still have a uterus, these meds can make uterine wall thicker. And if it makes it thicker, this can cause excessive uterine bleeding. This is not uncommon to occur. The bad part is you need to check the hemoglobin and hematocrit and know the lab value for that, because these will cause levels to go down because you will have excess bleeding when these occur. So that's another bad thing that can happen. It also can increase growth of cancers. If you've had cervical, breast, ovary, or uterine, it can actually cause cancer. So we do need to monitor for that. You don't want to use these drugs on women if they've had a history of any cancer. If they've had a history of cancer, especially cervical, breast, ovarian, uterine, this is not the drug for them. They cannot take these. And it will impair your liver. So it can cause pancreatitis. It also can cause gallbladder disease. So those are some things that we have to watch for. We want to make sure we teach our patients, take as ordered and on time. Don't miss doses. Stop smoking while you're on these drugs, because you know it will put you at risk for blood clots. Check for signs of jaundice, because we know it affects the liver. So we're looking for the yellow tinged skin, especially the yellow on the roof of the mouth, the eyes, any type of liver toxicity. Any of these things occur, and report that ASAP. Chest pain, shortness of breath, any swelling on one leg or another, any stroke symptoms, drooping the face, hard time moving, weakness on one side. This is something you need to call the ER, not call the ER, call 911 and get to the ER ASAP. Um, Contraception, 9-year-olds is when a female can have their first period and can become pregnant. Very sad that we have to ask that, but 9-year-olds, that's when it occurs. There are many methods of contraceptions out there. The most reliable form of contraceptive is not having intercourse. Surprise! So if you don't have sex, no baby. Forms of contraceptives, surgery, there's the barrier method, spermicidal foams, gels, IUDs, which is intrauterine devices. There are types of drugs for hormonal contraception. We can use hormones to suppress ovulation and prevent pregnancy. The effectiveness, if taken as ordered. Many forms, like I said, there's orals, topicals, transdermals, patches, uterine rings, IUDs, implants under the skin, which is sub-Q, injectable parenterally into the skin, and it gets absorbed slowly. Example as that is Depo-Provera. They get an IM injection. It's usually good for 3 months. They have injection little plants that go into the arm. So there's different types out there. So on page 495, 495, table, I don't think it's 495, 497. Sorry, 497. Table 32.1 are your common hormonal contraceptives, and there's tons of them out there, lots and lots of contraceptives. The oral contraceptives are mostly prescribed. They usually are called birth control or BCP pills. Hormonal contraceptives fold the endocrine system into not secreting estrogen and progesterone by mimicking pregnancy hormones. So it kind of fools the body thinking it's pregnant, but it actually is not. They are not pregnant. All right. And then we have combination pills, which have estrogen and progesterone. This we take at specific doses on a schedule. There's also something called the mini pill, which is progesterone only, and you can take this daily continuously. So there's different types of hormone replacements that they can use. Intended responses, it suppresses the ovum maturation, it suppresses ovulation, and no conception in pregnancy. Okay. Side effects, oral. You take it oral, it can cause breast enlargement and tenderness. It can cause some nausea. Definitely a lot of fluid retention. You're going to retain a lot of fluid and you're going to gain weight. You may have some breakthrough bleeding. That is not uncommon, that you've had no period for a while and then all of a sudden you have some breakthrough bleeding. And then it can cause acne. A lot of like when you, teenage years, when you have your hormones change, that's basically what this is. Now, adverse effects, if you're taking oral, high risk for blood clots, especially females that smoke and are older than 35 years old. It puts you at higher risk for blood clots. It also, if you retain a lot of fluid, fluid and sodium hang together. If you have fluid and sodium retention, it can lead to hypertension. So if you have hypertension, not the best thing for you. If you also have congestive heart failure, not the best thing for you. It also causes liver toxicity. So estrogen and progesterone metabolizes in the liver, so it can cause liver issues. So you want to make sure you check your liver before taking these medications. Synthetic hormones can increase growth rate of cancer cells, so cervical and breast cancer can occur. Even though you do not know that you have it or have a history of it, it can occur. Drospirenone used as progesterone, example Yasmin, will lead to increased potassium. And we know a normal potassium is 3.5 to 5. I always remember 3.5 to 5 bananas. And it can cause a lot of cardiac problems. So if it increases your potassium level, you can have a lot of cardiac issues. So you do not want to take these meds with any ACE inhibitors, because the ACE inhibitors, as well as these medications, will increase the potassium level. We do not want that because we know potassium will affect the heart. We're going to teach our patients you need to take the full cycle before it's effective. So use another form of contraceptive and don't skip a dose, because if you skip a dose, it will make it not effective. So you need to take a full cycle. And until then, use protective, use other forms of contraceptives. Take per scheduling recommendation. If not, you can have an unplanned pregnancy. And if that's something you didn't want, it may occur. So you want to make sure you take it as, take drug at the same time. Take it with food. Don't take more than 1 dose daily. Don't smoke or use any forms of nicotine because that will increase your risk for clot formation. You can miss 1 dose without issues in a cycle, but if you miss more than 1, make sure you use other forms of contraceptives and finish the cycle of the drug. Make sure to report on these meds before you take any over-the-counter herbals. Even some of the antibiotics and medications can cause these medications to become ineffective, and that can cause an unplanned pregnancy. It will make them less potent, and it can interact with other medications. So it's very important if you're on birth control and you're going to start any antibiotic or any medication to talk to the pharmacist or your physician, because it can make the medication less potent and can cause pregnancy. Report any signs of liver toxicity. Remember, these medications will not prevent HIV or STDs, so make sure you use condoms. Besides, pediatric population is not recommended. It can cause growth in long bones to stop growing, so that's not a good thing. And pregnant and breastfeeding population, of course, you do not want to take while pregnant because the purpose of it is to prevent it. So you do not want to take it while pregnant. And you should get a pregnancy test before you start the medication, because the contraceptives, because if you're pregnant, it's not going to be worth giving. If you think your pregnancy, the doctor ASAP. Don't breastfeed while on the med, and drugs do interfere with lactation, and it does pass in the breast milk. But remember, you have to be very cautious because a lot of medications out there can cause decreased effectiveness, and people don't realize, like antibiotics and all that. So you have to be very cautious when you use these medications, because you can have an unplanned pregnancy. And a lot of times, like I said, STDs, HIV, AIDS, those are some things that you still have to wear a condom for to prevent those things. So that is basically chapter 32. That is the last of our chapter in the book. So you guys have a good one, and call me with any questions.